major breakthrough in the United Nations approach towards drugs. A public health response to the drug use problem should consider alternatives to penalization and incarceration, the UN anti-drugs chief Yury Fedotov said on the opening day of the 57th session of the UN Commission on Narcotic Drugs in Vienna.
Evidence-based, health-centered approach to address illicit drug use and dependence have not been successfully implemented everywhere. It is important to reaffirm the original spirit of conventions focusing on health.
People who gather here are mostly from ministries of interior. There are a lot about law enforcement, because this is the United Nations Office on Drug and Crime. And there's a bit of, and there has been too much of a confusion between the drug problem and drug trafficking and crime. But the vast majority of people who use drugs are not criminals.
In the United States, already 2 states regulate cannabis for general use. It's time to change, according to a former U.S. prosecutor.
You know, we have sold the idea of prohibition, that we're going to save our kids from drugs, and we have put more drugs in easy reach of our children at cheaper prices in more concentrated dose. If we really care about our children, we're going to look at the facts and see that we need to control and regulate substances are dangerous, not because drugs are good, but because prohibition is worse and involves more harm.
They are starting to understand that the problem is not only prohibition of marijuana, but prohibition of all drugs. And they are also starting to claim for legalization and regulation of all drugs.
More and more member states acknowledge that penalization and incarceration of people who use drugs is not the road to a successful drug policy. In fact, harm reduction measures focusing on prevention, treatment, and individual human rights are not only more successful, but more cost-effective as well.
Those countries that implement harm reduction have no more growth of the epidemic among people who inject drugs, and those countries that do not implement those measures have a continuing epidemic. I think this is almost the strongest evidence you have. There is a changing mood here, and certainly, you know, words coming from the executive director of UNODC calling for what he calls a balanced approach, a health-based and health-oriented approach.
The Vienna meetings seem to be a milestone on the road towards the UN Special Session on Drug Policy in New York in 2016.